Hello everyone, I am Dr. Santosh Kumar, Orthopedic and Joint Replacement Surgeon based in Kolkata, founding director of Momentum Orthocare. Well, the Momentum Orthocare is our team dedicated to bring the very best of orthopedic and joint replacement to the city of Kolkata, and I invite you from wherever you are to come to us if you need any joint replacement treatment. We will give you the world's best at the most affordable prices and the latest in the system. So before this also we have discussed about several problems, several joint related problems. So today we will be discussing about hip replacement. Hip is the biggest joint in the body. It's a ball and cup joint. Like this is the structure of our spine and pelvis. Many people confuse spine pain with hip pain. Spine pain is always in the back, lower back or buttocks, but hip pain is in groin. So spine pain is separate from hip pain. We must understand that. So this is what is spine and this is the hip joint. This is the ball and cup joint. Hip pain is felt in the groin and front of the thigh. So it is never felt generally the back or in the buttocks. The pain which is felt in the back of the buttocks or sides is from the spine, and the pain which is from the hip is generally felt in the groin and front of the thigh. Sometimes it radiates down to knee. Hip pain can also be felt in knee. Now hip is the biggest joint in the body. We have two hips, right and left hip, and this is the junction between the thighs and the pelvis. So this is basically the junction between the thighs and the pelvis, and we walk on hip, we stand on hip. Even for sitting down we need movement of hip. So anything which affects hip joint thoroughly incapacitates us in terms of movement and normal life. It drastically jeopardizes our activities of daily living. So hip problems are a significant issue, and when discussing about these hip problems, we need to understand the common hip problems that we normally face. The commonest hip problems that we normally face are avascular necrosis, ankylosing spondylitis, and injuries and fractures around hip. For these problems we need to do hip replacement. Many times we need to do hip replacement. And hip replacement is a life-changing surgery, and it is the most successful surgery in orthopedic science today. There are some other problems also because of which we may need hip replacement, like primary osteoarthritis. Primary osteoarthritis means wear and tear of the hip joint. There can be secondary osteoarthritis because of the developmental dysplasia of hip. There can be tubercular arthritis. All those things are there. But majority that we face, most of them are either avascular necrosis or ankylosing spondylitis and of course fracture around the hip joint. So let's first understand what is this avascular necrosis. We'll discuss avascular necrosis, ankylosing spondylitis and fractures around the hip joint. So first let's discuss what is this avascular necrosis. Like we showed, this is the hip joint, is a junction between the thigh and the pelvis, and this is where the hip joint is placed. And hip joint is a ball and cup joint. There is a bone called head of femur. Like this is the bone called head of femur. This is the head of femur, and it has got a blood supply through the arteries which go to the head of femur. And this blood supply can be jeopardized, which can lead to avascular necrosis of the hip joint. So this blood supply can be jeopardized in various ways, but most of the times the actual cause is unknown, which we call as idiopathic AVNA, unknown cause of avascular necrosis. The other known causes are prolonged steroid use, prolonged analgesic use, very high alcohol abuse. So all these things can lead to avascular necrosis, and we find several cases because of prolonged steroid use we find avascular necrosis. But most of the times the cause is unknown. We do not know why it has happened. It just happens randomly. The symptoms of hip avascular necrosis of hip, like avascular necrosis can occur in many parts of the body, many bones, but we are talking about avascular necrosis of hip. So any hip pathology will start with intermittent pain, groin pain. The groin pain will initially be on walking. So we call it antalgic gait, means painful gait. There will be painful walking, there will be intermittent pain, there will be painful limping, and gradually the pain starts at rest also. Like when a person is sitting, sleeping, that time also the pain starts. The pain is characteristically from groin and it goes down to knees. So it is in the front of the thigh. There is difficulty in walking, there is difficulty in sitting, and there is rest pain also. Like when a person is lying down for sleeping, night time also there will be pain, and there will be muscle spasm. The movement becomes increasingly painful. That is the problem. Even if the person is not walking, pain is there. So it becomes increasingly painful. So these are the symptoms of avascular necrosis. Avascular necrosis symptoms are mostly of any hip arthritis. So it is groin pain which keeps on increasing. Now hip pain is more incapacitating than any other joint pain, because it is not only the issue of walking, it becomes difficult to sit also, it becomes difficult to sleep also, it becomes difficult to turn sides also. That is why hip arthritis is far more incapacitating than any other joint arthritis. Now the treatment of avascular necrosis, initial treatment is physical therapy, then we go to surgical treatments. Surgical treatments, the first one is core decompression, means we decompress the core of the femoral head, and that is supposed to decrease the intraosseous pressure inside the hip, the neck of the femur, and supposed to increase the vascularity, blood flow. We sometimes put vascular fibula graft to increase the vascularity. We also use stem cells, and we also use bone transplant. We use stem cells, and sometimes we use osteotomies to change the weight bearing site. For example, if one area is affected and it is becoming painful, we do rotation osteotomy to shift the body weight to other area of the bone which is not that affected. All these treatments are there, but the single most important, most successful, most predictable solution is joint replacement. Once AVN advances, once there is significant difficulty in walking, sitting or lying down, there is painful walking. Once the difficulty is significant and it causes difficulty in activities of daily living, then the most predictable solution is hip replacement. Hip replacement is the most successful surgery, and if perfectly done, precisely done, it is a life-changing surgery. So hip replacement is the single most important, most successful treatment of this problem. Now avascular necrosis has got stages. Like in initial stage, this is stage 1, stage 2, stage 3. So it is a gradually progressive disease. What it means is that whatever area of head is affected today will increase after some time. It is a gradually progressive disease. So this is the problem with avascular necrosis. So initially the basic investigation is to do an X-ray. The basic investigation of any hip pathology is to do an X-ray. So we do an X-ray first. This is a hip X-ray. This is the head of the femur, this is the hip joint, those two sides of the hip joint, this is pelvis. This is known as X-ray, both hips with pelvis, AP view. But in early stages we cannot see anything in X-ray, in AVN. So that is the problem in AVN. If we want to detect it in early stages, X-ray may not be sufficient. We can't see anything in X-ray. In that condition, we have to go for an MRI. MRI picks up very early signal changes in avascular necrosis of hip. MRI is the investigation of choice for very early AVN. And later on in moderate to advanced stages, it is seen in X-ray. Once it is seen in X-ray, then MRI is not that very useful after that. But MRI initially is very useful to pick up very early AVN. So we do an MRI, and after that multiple treatments are there. As we discussed, we have stem cell therapy, we have autologous chondrocyte implantation, and vascular fibula graft is preferably a vascular fibula graft is put inside in the hope of decreasing the intraosseous pressure, in the pressure inside, and promoting vascularity by putting the vascular fibula graft. So this is what is done in early stages. But all these treatments are not that predictable. The problem with other treatments is it is not that predictable. Hip core decompression, whether it be core decompression and vascular fibula graft, whether it be stem cell therapy, all those things are not that predictable. So the most predictable solution is hip replacement. Now what is this hip replacement? The ball and cup is replaced by an artificial prosthesis. So there is a cup and there is a ball and there is a stem which goes inside the femur bone. So this is hip replacement, and we will see subsequently what are the components of this hip replacement, what are the what are the components of this hip replacement, how many types of hip replacement are there. We will see it significant subsequently. So as we talked that in early AVN, X-ray do not show anything, but in advanced AVN we can clearly see arthritis, presence of arthritis in the X-ray itself. and once it is seen in X-ray, then MRI doesn't have any, there is no role of doing MRI again. So this is in advanced stages, we can clearly see that the joint space is diminished and the femoral head has subluxated externally and upward, outward and upward. So there are basically two types of treatment of avascular necrosis. The most predictable is hip replacement, and there are some treatments in very early stages. We try to delay hip replacement by using stem cells or core decompression, or as we discussed, derotation osteotomy. Sometimes we do derotation osteotomy, means we rotate the part of the femur which is femoral head which is affected, and we bring about the healthy part in the weight bearing area. So this is rotational osteotomy. This is also done in early stages, but all these things are not as predictable as hip replacement. Hip replacement stands as the gold standard in the treatment of avascular necrosis, and we will subsequently see what are the types of hip replacement. Hip replacement implants are can be cemented, can be uncemented, can be ceramic on poly, can be metal on poly, can be large head, dual mobility. So all these things we have discussed earlier also, and subsequently in the next talk also we will see. And this is about avascular necrosis of hip. If you know anybody or in your friends or family who is suffering from avascular necrosis, then you can always ask them to get in touch with us. We will do the best possible treatment. Over here we do robotic arm assisted hip replacement using MIS technique, and you are welcome to come to Momentum Orthocare in Kolkata. We will give you the world's best at the most affordable prices. We have multiple range of hospitals in which we operate, and based on the budget in which we operate, based on the insurance we operate, and I can assure you that within your budget we will give you the world's best at the most affordable prices.
We at Momentum Orthocare are committed to restore the joy of movement, to bring the very best of hip and knee replacement
to you, and we are available at Kolkata. So we are a big team with me, other orthopedic surgeons and paramedical professionals, assistants, technical OT assistants, physiotherapists. So we are a big team of around 100 people, and we operate in 2-3 hospitals. And the most important thing is that we help everybody and anybody who needs that treatment. So we make sure to make the whole thing as smooth as possible. If you have any of those insurances, we make sure to make it cashless. We serve in our hospitals. We serve for all nationalized insurances like National Oriental, New India, United India. Most of these nationalized insurances, they have fixed package without any breakup. So that's a good thing. And some of the private insurances, they also have a fixed package like Star Health, HDFC Argo, Bajaj Allianz. So they have fixed package. And then there are some other insurances which we have been serving like IFCO Tokyo, ICICI Lombard, Royal Sundaram, Max Bupa, Niva Bupa, all those insurances which we have been serving. And we make sure to that a patient having these insurances gets the treatment in a cashless way. We make the whole treatment cashless. And if a person is having any of those state or national insurances like state sponsored insurances, that also we make sure that the person gets the best possible treatment in that. And most importantly, if anybody is not having any insurance, we make sure that we give this world class treatment to that patient within the budget of that patient. So sometimes the choice of hospital may vary based on the budget, but we make sure that the treatment is same, whether the hospital is very big or relatively moderate hospital, but the treatment is same, and we make sure for that. So we are committed to bring the best of knee and hip replacement in the city of Kolkata, smoothest way and within your budget and affordability. Thank you.